going on, my peoples? What's going on? Today, I figured I wanted to talk about hospice workers. I know it seems to be a little strange subject for you, but the thought of hospice workers to me, I know it's necessary for us to have hospice workers, and for the most part, I believe that they do good. Most of them mean well. But on the other hand, a part of me believes that some of them, in my opinion, are just like death whisperers. It seems like you could go to the doctor or go to the hospital or go get checked up or something like that, get diagnosed with something, terminal something or whatever. Next thing you know, you're on hospice. Next thing you know, you're in the ground. That's quick, in my opinion. So it got me thinking in my own personal experiences with people that have died and things that I've seen, it seems to me like the hospice thing, I guess in some cases you may need hospice, but to me, it seems like those people, some of them are just whisperers of death. Now, I know death comes to all of us and there's no getting around death, and we should actually celebrate death, in my opinion, you know what I'm saying, as the next life or the next form or the afterlife or whatever you may believe in your spirituality or religions. But the thought of death has always fascinated me since I was a little kid, you know what I'm saying? I guess I'm a little weird, yeah. I used to check out, Faces of Death and stuff like that, other little things. I remember being scared of dying. But now, I'm at the point now where I don't fear death, but I probably fear death of those that I care about around me. That probably makes more sense of where I'm at now with the whole death thing. But I think some of these hospice workers, man, like I said, for the most part, don't come after me, hospice workers. Don't come after me. But I think for the most part, some of y'all are really doing good. You just want to ease the person off into the next life. But I think a lot of you try to usher people into the next life, especially in some of those states where it's like 11 states, I believe, that you can decide that you want to take your own self out. And these people help facilitate that. These hospice workers that work in these states, they facilitate that. So, is that right? I don't know. I guess legally it is right within those states. But to me, it seems a little odd, that you would help get the ball rolling on some of these things. And I believe, when you talk to people about dying and stuff like that, especially when, I think it just has a negative effect on the whole body. Like I can remember my grandfather, he went, he smoked and drank for 50 years, I believe, and I guess he went for a regular checkup and they told him that he had something, and it seemed like immediately after that, he went down, you know what I'm saying? But up until that point, he was his normal self. He just went for a regular checkup and was told that he had terminal cancer. And next thing you know, his body deteriorated just like that. I used to work with a lady in Roanoke named Brenda, rest in peace. You could see it. You could see it on her face, when she had cancer. So you knew she was dying. To me, definitely when somebody's dying, they have a look that you could tell. But I know people need hospice because, to be truthful, a lot of families are degenerate. They're just sitting around waiting on the person to die. And especially they got some money that they handed down to. So I can understand in a lot of aspects, the hospice worker is probably more like family in the end than their regular family, because some of their family ain't nothing to begin with. It's one of those weird things. But I believe hospice in general is necessary, but I do believe some of them are whispers of death. So I'd like to share a couple of videos of how I think that hospice workers and doctors that give people terminal news, I just think it's kind of a weird and wicked thing in some kind of ways. We're going to take a look at these videos without further delay. Here we go.
Actively dying phase that I want to show you. So I know this is hard and people will not want to watch these videos, but the reason why I think it's so important is because we don't know what it looks like to die. So when people see it in their real life, they feel traumatized because of the things that they witnessed their loved ones going through. A part of the educational process is to actually see what it looks like. If you see what it looks like in these videos, then if you see it in your real life, you'll be better prepared. I want the dying process to feel more sacred instead of like this emergency that you have to feel panicked around. The more we see these actual images, I think the more we will understand them and the less we'll fear them. I want to lessen the fear of death and create better understanding of what it actually looks like. And I think the more you watch these videos, the more your brain can process and experience what these videos are showing you. So when it happens in your real life, which is as shocking, you will understand it more. And if you can understand it more, you can have less fear and actually be present in that moment for your loved one who's dying. And this is not to desensitize you, but it's just so you can understand. You can understand what you're seeing and why it's happening and how it's affecting your loved one. Our brain will process events in our life differently if it's the first time we're seeing it or if we have already seen it and understand it. So this is a good way to help your brain see something, process it, understand it, learn about it, so you can have a different experience next time around.
Now, this lady is one of those hospice workers. She works in those states that you can take your own self out in, and she's also one of those ones that help facilitate that. So she actively is telling you about the processes that she sees when she's dealing with some of these patients that are dying. Now, I'm not going to say my personal opinion. I think she one of the ones that usher you into death rather than the ones that help. But that's just my opinion. Don't unalive me now. Don't unalive me. But she's going to take you through these processes that show you what these hospice workers do actually in these homes and around these families that sometimes and a lot of times agree to what the hospice worker is telling them they should do for their loved one that may pass on. Let's continue.
And of course, I will not show any of these videos without giving you a clear trigger warning that I'm about to show you the video. And just so you know, these are not my patients. I have been given these videos with written permission saying I can share them for educational purposes. Okay, so this first video that I'm going to show you, the family sent me this video saying that their grandmother died about 12 hours after this video was taken. What you're going to notice in the video is just that her mouth is open. The way she is breathing, the way she is unconscious, how she's laying in the bed looks very normal for someone who is actively dying. I can say wholeheartedly that this person is experiencing peace and is not having any pain or suffering in this moment, despite the fact that she looks like she may feel a little short of breath. You'll also notice at the very end, she takes one last gasp. also very normal. So just on a side note, the family said that 4 days prior to this video, this patient experienced her terminal lucidity, which is the rally or the surge I talk about in my other videos, where she had a really good day. She had a burst of energy. She had a really good day. And then 4 days later, this video was taken, which she died 12 hours later. So that's very, very common for the dying patient. And also about a few weeks earlier, she had been talking to her sister who had died 30 years earlier. So this woman in this video is following the direct path and the direct progression of death and dying. So trigger warning, here is the video.
Now, I was, in my personal opinion, in this situation, I was looking at it like, damn, she looked like she, or whoever was recording was getting a enjoyment out of this. I don't know why you would record unless the person wanted that to happen. But it looked kind of strange to me that you get this recording from this family when their family member is dying like that. Me personally, I wouldn't want to record my loved one like that unless that was their will. But I guess, hey, some families are different. So that's just my opinion, y'all, you know.
Okay, so if you noticed in that video, she had oxygen in, which probably was not totally necessary, but a lot of times hospice companies will have the person on oxygen. You saw that her mouth was hanging open. That's because our muscles are so relaxed. We don't close our mouths. So we have a lot of mouth breathing. She was breathing so shallow, you could barely see her breath until the very, very end when she took that gasp, which is also all very normal. So this is a very normal and peaceful death and dying video. So the next video, we see a lot of the same thing, but you'll notice the eyes more. So this next video, you'll see her eyes are open and fixed at the ceiling. You'll notice her mouth is open again, like the last video. I think in the next video, you'll really see the changes in breathing a little better because you can see her breath more, her chest rising and falling, and you'll hear terminal secretions, which is that death rattle. So trigger warning, here is the next video.
And once again, I take issue with the person with the camera, you know, like right there in the face, you know. If I'm going out, hey, to my family, shout out to my family. If I'm ever in this situation, please don't record me, please. I mean, you know, I guess it's for educational purposes, like they say, but to me, you know, a lot of that stuff is kind of weird.
Okay, so as you saw in that last video, you could see her eyes were not blinking. Her eyes were fixed at the ceiling, which is very normal. All of this happens because our muscles are really relaxed. So we don't close our eyes, we don't close our mouth. She likely was not conscious. So although her eyes were open, she was not making eye contact. You could hear the terminal secretions, which are very normal and are not affecting the person. And you could see the changes in breathing. Now, again, all of those things look different and scary to us, but they're actually a very normal part of death and dying and are to be expected. We can tell by the way she is laying, how calm she looks, that she is not bothered by these changes. And they're actually biologically normal, and there are metabolic changes that are just happening because the body knows how to systematically shut down and die. And the less we mess with that, the better the person will feel and the more peaceful they'll die. And remember, the body is built to live and the body is built to die. And these are all of the normal built-in processes that happen when someone's dying. So I know those were hard to watch, but I'm glad you stuck with it. I would really like to know what you guys think in the comments. So let me know how you feel after watching those videos. And don't forget to like and subscribe for more death and dying information.
Now, if you want more Nurse Julie, I believe she has a YouTube channel. You can go to her page and subscribe if you like that type of stuff. Me, I just wanted to share this video because it got me thinking about, how hospice, how did that even become a job? I guess, they make a job for everything, but to me, I don't think if I was ever looking to have a profession, I don't think hospice would be one. I guess you get paid well for it. I guess in the long scheme of things, you get paid well. But for these hospice workers and, doctors, that this is their job, to tell people, I guess you want to hear the truth in the end, I guess if you are dying, but sometimes could you get misdiagnosed? Could that be, has that happened before? I just wanted to know what y'all thought about this type of stuff. What did y'all think about the hospice workers and doctors who have to tell patients that you're dying? We're going to check out one more video, then I'm going to shoot up out of here. Yes, sir. Yes, sir. It's crazy out here. The death whisperers, that's what I call them, the death whisperers, y'all. You know what I'm saying? You go to the doctor, just get a physical. Next thing you know, you got terminal cancer. It's crazy out here. But hey, we all live and we all die. I guess my aspect, I don't think, for those states the 11 states that do it, I guess, you choosing your own path or choosing when you want to die, if you make that decision personally. But my opinion, we never know when we're supposed to go. I think it was meant to be that way. You never know when you're supposed to go dealing with death. And like I said, I think it's more painful to lose the loved ones around you than me personally dying. If I died today, I know I live on. I know that much. The kid live on, y'all. The kid lives on. So I think you have to have some type of inner peace when dealing with death. But like I said before, it's harder to lose your loved ones around you. But I think, the mind sometimes is strong because you can believe, like you'll see in this next video, they actually believe that he was going fishing and going on his trips and going on that. And then the next thing you know, you're in the hospital. And then the next thing you know, you've been told you're dying. It's crazy, man, out here. It's a crazy world. But it's part of life.
When serious illnesses take us to hospitals, we look to doctors for answers. But what happens when there are no more cures?
Do you want to call her daughter?
Zara Cooper is an emergency surgeon with palliative care training at Brigham and Women's Hospital in Boston. She frequently must deal with patients surprised that they're nearing the end of life.
It's certain that everybody's going to die. There's no certainty as to when.
It's not clear from the CT scan what's going on.
And frequently, as an emergency surgeon, I'm meeting somebody for the first time and they have no idea that they could die from their disease. Whether that's because nobody's told them or they're in denial, I don't know, but it's always a surprise.
Clyde Earle has been undergoing treatment for advanced cancer for a year. He's now suffering with intense pain. The prognosis is not good.
Well, you're in good hands here, Dr. Cooper.
I know.
Dr. Cooper wants to talk to Mr. Earle and his wife, Audrey, about what comes next.
The rumor has it you guys are newlyweds. Is that right? Huh?
Yeah.
That's great.
In March.
Now, what happened before you came into the hospital?
One morning,
I had so much pain, I could not take it. I was in deep trouble.
Yeah.
3:30
with pain.
Yeah. What I discovered was that he and his wife had the expectation that he had many more months. So let me ask you, what do we expect to happen after you leave the hospital?
We're going fishing.
Okay. Okay.
We're going up to a house in Maine.
Okay.
Okay. And then after Maine, we'll go back to a house in Florida.
Right.
Right. Now, has anybody...
Now, see, you know, that's what I was just telling y'all before. You know, the guy thought they thought he had months or maybe possible years, you know, saying to go on with his new bride, I guess at his older age. But sometimes going into them hospitals is something, in my opinion. Sometimes going into them hospitals is something. To me, them hospitals got that weird smell. Sometimes it smells like death. That's why I personally don't like going in the hospital unless I have to. But that's just my opinion. Let's continue.
talk to you about hospice or having hospice nurses take care of you, or is that part of the plan?
Women, if we need it.
Right.
I know the procedure.
Yeah. When I said hospice, it was as if I was talking to somebody who only thought that hospice would be necessary when he was just about to die. My impression was that that was the goal, was to get him to hospice. I think my primary concern is... I think the lesson learned is that you have to ask. You know, you can't make those assumptions because oftentimes patients and their families aren't at all where you think they are and aren't at all where you think they should be.
But Zara Cooper had at least started a conversation about the end of life.
We are here to take care of you, okay? All right.
Now, see, that's another thing that I was talking about, is how she expected, you know, them to be thinking about hospice and thinking about these type of things. Why would they be thinking about that? You know, I know you're old and everything, but you don't want to be thinking about getting on hospice because, damn, then they know that 2 steps from death. So I guess in your own personal thing, you have to choose to live as long as you can, you know, before you would choose to do hospice. And like I said, in my opinion, just let me pass on, I guess. I would just say, let me pass on to that great beyond before I go out like that. But let's continue.
As Clyde Earle's condition worsens, Dr. Cooper brought in Kathy Silvaggi, a senior palliative care physician whose expertise is in end-of-life care. She would now take up the hospice discussion.
She and I had a conversation about goals of care and
when Dr. Silvaggi came down to the ICU to meet them, I said, you know, you've got a lot of work to do. She said, I know.
That it was really important to take his wife aside and talk about what I was seeing.
Hi.
How are you, Audrey?
Let's not ask a question like that.
I know. Clyde? Good morning.
It's been like this. I don't like it.
I know you don't.
I don't like it at all.
It is a process. And I think, you know, it is very hard to come to the realization that you're dying. These are really important conversations that should not be waiting the last week of someone's life. I'm not sure I'm going to get him back to Maine.
We're not. Let's face the truth.
I don't think we are.
No.
I think he's going to be here with us.
Yeah, I know he is. I guess I was in my own world. Figuring everything could be fixed. In my heart, though, I knew better. I knew what was ahead. And I didn't share it with him.
It's those moments when people show that they want to talk about it. once somebody gives you that kind of opening, in palliative care, we're trained to take that opening and to identify that as a moment where you can help somebody. Whereas I think the natural inclination is to say, we're going to get him better, you're going to get him home, because it makes you feel better.
Oh, I love you. Oh, I love you, honey.
So you see, man, the whole hospice thing, and it's just crazy to me. It's just crazy in my eyes, man. It's just crazy that there's an actual job out there that people do. Like I said, I believe some are good. Some are good and just really trying to help facilitate the person to the other side. But I think some of those, like, if you listen to some of the words that they used, you know, it was like they were waiting for their entry, you know, so it was like they was trying to usher that in my opinion. They was trying to usher death in. And I think that's where I have a problem with that. You know, if the person is dying, they're dying, you know? There's nothing we can do about it. But when you kind of is like trying to speed up that process or getting that person to accept that they're going, that's a big decision for somebody to accept, don't you think? If they passing on, I don't care how old you are. So I don't want to be whispered death, in my opinion. So on the hospice thing, the kid will pass. But what say you? That's why I brought it to your attention, because I wanted to know what y'all thought about the whole situation of hospice and the need for it. And do you think these people are good people in general? And do you think some of them are death whisperers? You know, I know we can't live forever, but you can live a little longer, in my opinion. But once again, let me know what you think. I'm out of here. It's your man, Chris B. Thank you, YouTube and Facebook, for tuning in. If you're on Facebook, jump on over to YouTube and subscribe to Chris Barber. And if you're on YouTube now, subscribe to your boy. I'll get back with ya. Peace.